Good. So an organization that many of us who are medical have gotten involved with, IPPNW, again, use that same message to say that nuclear weapons also were unacceptable. So what they did was they published this paper in the New England Journal in the early 1960s and said that if we did have a nuclear attack on Boston, just an attack on one U.S. city, there wouldn't be enough burn beds in all of the U.S. to actually manage the victims of one city. And you'd have 98% of your medical personnel dead, because not only do they work in the center of the cities, they also live there. And that you couldn't really mount an effective response. We've seen what's happened in Haiti recently, so your whole infrastructure would be disrupted, and we saw it in Iraq too. So basically it was really not meaningful to think about winning a nuclear war, of responding, going into bomb shelters. And so in the event of a nuclear attack, don't bother to call your doctor. And because of this, again, moving nuclear weapons or nuclear war issues to being a medical issue, they calculated the number of deaths on various places like New York. We've done that in Canada too. And so we use a moral argument, the care of our families, and we use this type of thing, saying that nuclear weapons are bad for your health. We use the stories of people, of victims, of our patients, of doctors who've been victims of Hiroshima. Medical students have worked on things. Some of these faces might be familiar to some of you here because some of you have been active in this in the past. Again, putting a target X in the middle of major cities and then talking to passers-by and say, this is what the effects would be if we had an attack on our city. And Mikhail Gorbachev was very moved by the message of IPPNW. And he said in his book Perestroika that doctors really had it right. And it was because of IPPNW that he agreed to disarming more than what his generals told him was practical. Because his generals said, oh, the U.S. is getting an advantage. They're disarming less than what we are. And Gorbachev said, well, if we had a war, nobody would win. So having this many weapons really doesn't help. So Gorbachev continued to work against nuclear weapons. I just put this up here because I enjoyed meeting him. But I've also spoken in India about nuclear weapons. And again, I try to use my credibility as a person of Indian origin and speak about what the effects are in India with a strike between India and Pakistan. So that's one way of managing population. That's not exactly the way that we really want to do things. And strategically, nuclear weapons really didn't operate in India's benefit when Pakistan tested in 1998, 3 weeks after India did, reducing the two to parity. And so strategically, in terms of health of people, in terms of everything, India was doing what didn't seem to make a lot of sense. And so I used another medical analogy, the analogy of addiction. And I won't go through what addiction is. But again, trying to use a bit of a medical message to say why people do things that are irrational.